We will now demonstrate some of the most common in-clinic frontal and sagittal plane modifications applied to a thermoplastic prefabricated orthotic. These are examples of popular modifications for a pronated or a supinated foot, or to facilitate sagittal plane function in a foot with ankle equinus or functional hallux limitus. A rearfoot varus intrinsic wedge involves grinding the plantar surface of the orthotic shell. Grinding down from the lateral side, removing more material and tapering to the medial side. This will create a varus or medial wedge. Using your DOLA Orthotic and a grinder, follow the steps in the following training video.
How to modify a full-length DOLA Orthotic with a rearfoot varus or medial post intrinsic grind. A rearfoot varus post is a rearfoot wedge that is thicker on the medial side. Common grinds include to the rearfoot post clinical markings, or measured to a specified angle using the heel bisection line. In this video, we will show you how to complete a 6-degree intrinsic rearfoot varus grind on a full-length DOLA orthotic. Step 1. Mark the heel bisection line. Step 2. For a varus or medial rearfoot post, mark a point or line on the lateral side of the heel cup. Use the mild or moderate clinical markings or use a tractograph to measure and mark your required angle. You now have your angle marked as a guideline for grinding. The aim of grinding is to remove the orthotic shell material from the lateral heel up to your guideline and blend it at a gradual angle to the medial side, leaving the medial border untouched. Holding the medial and lateral sides of the orthotic shell, place the posterior plantar heel surface of the orthotic against the grinder. Hold the orthotic at an angle and remove material up to your lateral guideline. Ensure that this angle keeps the medial side untouched. The medial side will remain thicker than the lateral, creating a varus or medial wedge. Remove small sections of the orthotic at a time until you become comfortable and check your progress against your guideline. The orthotic orientation chosen in this video allows visualization of the guideline. Alternative options include rotating the orthotic, which may also assist in the ergonomics and ease of this modification. Continue to remove material until your grind connects the lateral and medial sides of the rearfoot post. The DOLA Pro allows practitioners to grind in a varus rearfoot post up to 6 degrees without the need to glue on extra EVA reinforcement. Clinical markings including the heel bisection line and the rearfoot post guidelines aid in symmetrical grinding and accurate prescription. A rearfoot varus intrinsic grind is used to increase medial orthotic reaction force, apply a supinatory moment, and address tissue stress pathologies related to foot posture and biomechanics.
Rearfoot valgus wedge. The modification of a prefabricated orthotic shell with a valgus or lateral rearfoot post is commonly used to apply an orthotic reaction force lateral to the subtalar joint axis. It is commonly used in clinic to apply a rearfoot valgus post to an orthotic shell that is currently posted at 0, to increase the current rearfoot valgus post or lateral post angle, to increase the orthotic reaction force lateral to the subtalar joint axis, or to replace a worn-out rearfoot post. Indications for a rearfoot valgus wedge include to increase the lateral orthotic reaction force, to apply a pronatory moment, or for common tissue stress presentations including a flexible supinated foot, perineal pathologies, and lateral ankle instability. An extrinsic rearfoot valgus wedge is placed on the plantar surface of the orthotic shell at the heel, tapering from thicker laterally to thinner medially. Using your DOLA orthotic and a rearfoot wedge or wedge strip, follow the steps in the training video.
Rearfoot valgus post. Introducing our DOLA EVA rearfoot valgus wedges available in small, medium and large sizes. Customization of the DOLA Pro with the addition of a rearfoot valgus wedge. Place a self-adhesive EVA rearfoot wedge on the plantar heel surface of the DOLA Pro, ensuring the wedge is thicker on the lateral side compared to the medial side. This modification can be used to increase rearfoot valgus control or increase the orthotic reaction force lateral to the subtalar joint axis. This can be used for conditions including lateral ankle instability, perineal pathologies, and flexible pes cavus foot types.
Heel raise. The modification of a prefabricated orthotic shell with a self-adhesive EVA heel raise will elevate the heel with respect to the forefoot. Common applications for heel raisers include for general sagittal plane facilitation, for an ankle or forefoot equinus, for various Achilles pathologies, for calcaneal apophysitis or children's heel pain, to improve propulsion, to address a mild leg length difference, or for general orthotic troubleshooting and adjustment. Selection of the EVA heel raise will depend on the required height and the type of orthotic shell. A shank-dependent orthotic shell, including EVA, will require a longer EVA heel raise, depending on height. A shank-independent orthotic shell material, including polypropylene or carbon fibre, will require a short EVA heel raise, just applied at the heel. A heel raise will taper from proximal to distal. Length options include the heel only, to midfoot, to metatarsal heads, or full length. Using your DOLA Pro orthotic and your EVA heel raise, follow the training video.
Heel raise. Introducing our DOLA EVA heel raise pads, available in small, medium and large, and in both 5mm and 10mm thickness options. Customization of the DOLA Pro with the addition of a heel raise. Place a self-adhesive heel raise on the plantar surface of the DOLA Pro under the heel to raise the height of the heel with respect to the forefoot. This modification can be used for sagittal plane facilitation for ankle and forefoot equinus, Achilles pathologies, calcaneal apophysitis and Hageland's deformities. Complete your DOLA Pro with a customized top cover and dispense.
Medial arch pad. The modification of an orthotic shell with the addition of a medial arch pad to support the medial longitudinal arch. Indications for use include to support the medial arch, to improve orthotic comfort and tolerance, in a pes cavus or high arched supinated foot, to increase the arch height or contour of your prefabricated orthotic, to alter the arch high point position, to increase the medial orthotic reaction force in a normal or laterally deviated subtalar joint axis, or to address various tissue stress pathologies, including chronic plantar heel pain, tib post pathologies, navicular pathologies, and plantar fasciopathy. The medial arch pad high point can be used to influence calcaneal inclination, metatarsal declination, first ray characteristics and function, orthotic reaction force position, patient tolerance, and used to match foot morphology. Anatomical landmarks of interest are the posterior and anterior borders of the medial longitudinal arch. Select the required pour-on arch pad size and height. Place the arch pad on the dorsal surface of the orthotic under the medial arch. Assess the effect of the addition on symptoms or function. You can use strapping tape or hyperfix for a patient-adjusted location of the pad in treatment-directed testing. Using your DOLA Pro and your pour-on medial arch pad, follow the steps in the following video.
Medial arch pads. Introducing our DOLA pour-on arch pads, available in small, medium and large sizes and in both 3mm and 5mm thickness options. Customization of the DOLA Pro with the addition of a pour-on arch pad to the top surface of the medial arch area. Place a self-adhesive pour-on arch pad under the arch on the dorsal surface of the orthotic. This modification is a popular choice when you're looking to increase the support of the orthotic and to increase comfort. The addition can be used to increase the arch height, increase the arch cushioning, and increase the contour of the arch, and is also commonly used for pes cavus foot types.
Lateral arch pad. The modification of a prefabricated orthotic shell with the addition of a lateral arch pad. A lateral arch pad can be used for a variety of common presentations, including to support the cuboid or lateral column, for cuboid syndrome, perineal pathologies, lateral ankle instability, to create an orthotic reaction force lateral to the subtalar joint axis, flexible forefoot valgus, to promote high gear transition, in a rigid cavus or supinated foot with significant lateral arch for a forefoot equinus. Using your DOLA Pro orthotic and your pour-on arch pad, follow the steps in the following training video.
Lateral arch pad. Introducing our DOLA Pro and arch pads available in small, medium and large sizes and in both 3mm and 5mm thickness options. Customization of the DOLA Pro with the addition of a Pro and arch pad to the top surface of the lateral arch area. Place a self-adhesive Pro and arch pad on the top surface of the lateral arch area of the DOLA Pro. This modification is a popular choice when you're looking to increase the support of the lateral column, as well as placing an orthotic reaction force lateral to the subtalar joint axis. This addition can be used in conditions including lateral ankle instability and all perineal pathologies. Complete your DOLA Pro with a customized top cover and dispenser.
Forefoot valgus extension. The dorsal or plantar addition of a forefoot valgus extension to influence forefoot function. It runs from the calc-cuboid region to the sulcus or full length, the width of mets 2 to 5. It is thicker laterally, tapering to thinner medially. Indications for a forefoot valgus extension include to support a rigid forefoot valgus, to plantarflex the first ray, to improve propulsion, first ray function, first MPJ function, and to improve the windlass, provide lateral orthotic reaction force, provide a forefoot pronatory moment. Using your DOLA Pro orthotic and your forefoot wedge, follow the training video.
Forefoot valgus extension, dorsal application. Introducing our DOLA EVA forefoot valgus extension, available as a single size wedge with the ability to apply either dorsally or plantally. Customization of the DOLA Pro with the addition of a forefoot valgus extension. Using the available clinical markings located on the plantar aspect of the DOLA Pro as a guide, place a self-adhesive EVA forefoot wedge on the dorsal surface of the orthotic, ensuring the wedge is placed with the thicker side laterally. This modification can be used for a rigid forefoot valgus to place an orthotic reaction force lateral to the subtalar joint, for a pronatory force on the forefoot, lateral ankle instability to help the windlass mechanism and to aid in propulsion.
Reverse mortons extension. The modification of a prefabricated orthotic shell with the addition of a reverse mortons extension, or 2 to 5 bar or 2 to 5 pad. Indications for the use of a reverse mortons extension often include to improve first MPJ function by plantarflexing the first ray, in functional hallux limitus, to improve the windlass mechanism, and to improve propulsion. Mark the key anatomical landmarks of the calc-cuboid region and the ID space 1 to 2. Place the reverse mortons extension addition on the dorsal surface of the orthotic, anterior border to the sulcus, medial border to the second metatarsal head, or ID space 1 to 2. Assess the effect of the addition on first MPJ function and adjust as required. Using your pour-on reverse mortons extension and the DOLA Pro, follow the training video.
Reverse mortons extension. Introducing our DOLA pour-on reverse mortons extension pads, available in small and large sizing. Customization of the DOLA Pro with the addition of a reverse mortons extension. Using the available clinical markings located on the plantar aspect of the DOLA Pro as a guide, place the self-adhesive pour-on reverse mortons extension on the dorsal surface of the orthotic, running from the cuboid to the sulcus of metatarsals 2 to 5. This modification is used to plantarflex the first ray and to increase the range of motion at the first metatarsal phalangeal joint. This can be used for conditions including functional hallux limitus and to improve the windlass mechanism, which aids in propulsion.